So let's discuss the non-surgical options available. It's important to understand the difference between pain management and treatment. They are not the same thing. Symptom management means literally to feel better, to manage your symptoms, to reduce or eliminate your symptoms, but they never correct the imbalance. People with musculoskeletal pain are often offered anti-inflammatories or NSAIDs, non-steroidal anti-inflammatory drugs. If you take painkillers, anti-inflammatories, or have a cortisone injection, this is not treatment. Also bear in mind that steroid injections cause trauma to the tissues. And this is why it's shown that people that have repeated steroid injections are significantly more likely to have to undergo surgery. And the point of this video is, how do we avoid surgery? If you do not correct the dysfunction and you only manage the symptoms, yes, you feel better, but the dysfunction is still there. And this will create friction every time you move. You pinch that tendon, you pinch those tissues, and you will cause degeneration over time. And thankfully, this is avoidable. Treatment means we correct the dysfunction and the tissues will heal over time. Surgery is rarely needed, and this is something I can testify working with thousands of patients over the years. Most cases do not require surgery. With the correct assessment, hands-on treatment such as osteopathy, any hands-on treatment from an expert who knows how to deal with this problem. Combining that with rehabilitation and corrective exercise can correct or eliminate the impingement and not requiring a surgical invasive treatment method. So in summary, remember, symptom management is not treatment. It's fine to have symptom management, painkillers, anti-inflammatories, but do bear in mind it is not treatment. You want to see someone who can assess, diagnose, provide a multitude of hands-on techniques, progress onto corrective exercise, incorporating stretching, postural work, local isolation work to auto stabilizers, then progress on to primal movement patterns so you have full function back. You have to do the work, no one's going to do it for you, but if you do the hands-on treatment and combine it with putting the effort into the corrective exercise, that way you'll get great results. So I wish you the very best of luck. See someone in your area, start recovery today. Don't leave this problem to get worse, because it does get worse over time. See someone who knows how to assess, diagnose and treat, and I really wish you good luck and a very fantastic recovery.